Yes. So, good afternoon, everyone. I, Vedija Patil, associated with Connect to Clinic as a medical writer, welcome you all for this webinar on Clearing the Air, a guide to allergic rhinitis and nasal deviation. Now, our esteemed speaker is an expert in as an ENT surgeon, bringing us a valuable experience and insights for this virtual stage. Before moving on to the webinar and moving on to Dr. Vidit's credentials, I would like to have shed light on the connect on what Connect to Clinic is and its exclusive feature of Med Updates. Okay, Connect to Clinic is basically an AI based platform, OPD management platform, which revolutionizes patient and doctor connections through seamless online consultation, which closes the gap between the healthcare professionals and the individuals or the patients, basically offering virtual medical appointments. Then there is expert advices, prescription, that is e-prescriptions. Okay, the platform ensures convenient access to healthcare. Connect to Clinic's exclusive feature, that is Med Updates. Med Updates is very much pertaining or very much particular to a doctor centric feature. Med Updates, what basically it does is it captures or it takes data from the latest top notch medical journals, and it particularly has a research based team which focuses on the latest developments in the medical world, and it takes the data from the article and it summarizes for you. So whatever is happening currently in the medical world, be it any specialty. So we currently cater to 18 specialties. To name a few, there is ENT, there is cardiology, there is diabetes, dermatology, nutrition, neurology, urology, and there are many more to come. So we in all cater to 18 specialties. If you go on to Connect to Clinics website or the application which we have a separate section for Med Updates. In Med Updates section, if you go there, we have two sections in it. That is Med of the Day and Med for You. Med of the Day is a feature wherein we take the data from the journals which are highly trending in today's medical world, and we put the data in the Med of the Day section. And if you go to the below section, which is Med for You, it's specifically pertaining to your research data or basis on what activity or what behavior that specialist doctor has. So, if particularly an ENT surgeon is looking out for more on allergic rhinitis, or say, for example, if he is looking out for tinnitus, so what will happen is it will capture the data, and Med for You will specially customize the data for you, and will on the Med for You section it will show the tinnitus part, more or the less tinnitus part, and then other diseases also. It will show that for you. Now, this particular feature is very much exclusive to Med Updates and Connect to Clinic, and I am not really sure if I can claim it. No other OPD management healthcare platform is offering this service to any doctor or highly super specialty doctor. So I would request all the doctors or who are present to do visit Med Updates page and have a greater engagement for that section. Now let's turn all our attention to our very esteemed, highly experienced speaker today, Dr. Vidit Rohit Shah. Dr. Vidit Rohit Shah is basically a co-founder and a partner of CNV Healthcare, which is located in Vadhala, Mumbai. He has a very pivotal role in establishing a modern multi-speciality polyclinic with a diverse array of medical services he offers through this clinic. His leadership extends in assembling a highly qualified team and securing franchise of Agilus Diagnostics for comprehensive blood testing and lab testing. Okay, as a consultant ENT surgeon across promising healthcare institutions, including Spectrum Healthcare and Criticare Asia Hospital, Dr. Vidit actively is engaged in a wide range of surgical procedures. Also, his responsibilities also include creating detailed treatment plans, examining patient referrals, and collaborating with specialists for timely interventions. Now, during his tenure as a house officer at BDBA Shatabdi Hospital, okay, Dr. Vidit demonstrated proficiency in various surgical procedures, including those for head and neck cancers, then emergency tracheostomies as well. Now as a also his not only this, but he also he served as a registrar at state AGB municipal ENT hospital, which is in Mumbai. He managed the whole OPD caseload. He successfully handled the routine and complex ENT surgeries, which is really commendable, Dr. Vidit. And also, Dr. Vidit, his medical journey encompasses the roles which he served as a junior resident as SDM College of Medical Sciences. He also served as an intern, medical intern at Grand Medical College and Sir JJ Group of Hospitals. It's actually a great thing, Dr. Vidit. Also, I would like to add on to this as well. He has many publications in very top notch or very highly esteemed journals. Okay, to name one of the research paper or publication which we had in his journal is a comprehensive study on interventions in endoscopic sinus surgery, which is and a rare case on water jets injury for larynx and pharynx. And there are many more publications which we have. Now, Dr. Vidit, we are very much honored to have you with us today for this webinar, and thank you so much for your time for and connecting and getting on board. Onboarded for this webinar for Connect to Clinic. This is actually, let's have a very highly and enriching experience for all our participants today, Dr. Vidit. So, Dr. Vidit, all over to you for this today's webinar.
Okay. Thank you, Ms. Patil, for such a nice introduction and really kind words coming from your end. I would like to thank the entire C2C team for having me on this show, and I'm trying my level best to help the audience out in understanding, uh, not in medical terminology, but in simple terms about allergic rhinitis as well as nasal bone deviation, and what are the precautions we are going to take long term instead of the patient coming to get a treatment for a long term basis. If he can prevent the disease rather than the cure, so prevention is better than cure, as we say. So that is what my focus and highlight will be today. So that's it from my side. I think we can start if Miss Patil says.
Yeah, sure. We can definitely start the presentation, Dr. Vidit.
Yes, thank you. So yeah, the topic is clearing the air, a guide to allergic rhinitis and nasal bone deviations. So as we are aware that particularly post Diwali and the winter season, in metros like Bombay, Bangalore, Delhi, and also now in tier 2 cities where we're seeing a lot of poor air quality index. And COVID was a major factor also in bringing to light a lot of patients with poor lung capacity and also a lot of patients with allergic rhinitis coming to the forefront. Uh, Air quality index is a major topic of discussion among ENTs and chest physicians, and both are in a way interlinked because the nasal cavity, which is the upper respiratory tract, and the lungs, the lower respiratory tract, both have a common connection, and that's where we need to focus on because I need to uh, inform my audience that allergic rhinitis is coming in a huge way thanks to the El Nino effect, the global warming which is happening, particularly the pollution in the environment because of all the vehicles we are having, plus the population density. And allergic rhinitis leads, in fact, to allergic asthma. So we're going to focus on allergic rhinitis mainly and the nasal bone deviation. Uh, can we change the next slide? Yeah, so these are the topics of discussion today. Overview of allergic rhinitis, the types of allergic rhinitis, symptoms and duration, treatment and prevention. That would be the point I would be focusing maximum upon. Introduction to nasal bone deviation and correction, which goes hand in glove with allergic rhinitis in quite a few patients in my experience. So we can also discuss that. Can we have the next slide, please, Ms. Patil? Yeah. So overview of allergic rhinitis. So what exactly is allergic rhinitis? Allergic rhinitis is a diagnosis associated with a group of symptoms affecting the nose. This condition is triggered by exposure to allergens such as pollen, dust mites, pet dander, mold spores, or certain occupational irritants. So basically, what we say is any patient who's having recurrent sneezing episodes and sneezing episodes leading to a lot of nasal congestion and stuffiness is what we're looking at here in the patient profile. Can we have the next slide, please? So types of allergic rhinitis. So there are two types of allergic rhinitis overall which we see in patients. There's a seasonal allergic rhinitis and a perennial allergic rhinitis. Seasonal allergic rhinitis usually occurs in the spring, summer, and fall due to outdoor molds and pollens in the air from grass trees and weeds. And perennial allergic rhinitis can occur throughout the year. Often symptoms are caused by things found indoors, such as dust mites and animal dander. So, what's happening in the patients which we are encountering nowadays is seasonal allergic rhinitis has turned into a perennial form of allergic rhinitis, where we are finding maximum number of patients having these symptoms throughout the year, where in the past it was just a seasonal variation causing the problem. And a lot has to do with what we call as the hygiene within your home. So hygiene is one thing which I'm going to really focus on today, right from dust mites to animal dander. So we will be having a look at the perennial form of allergic rhinitis and its treatment aspects as well as the preventive measures. Can we have the next slide, please? Yeah. So the symptoms and duration of allergic rhinitis. So as we mentioned, there is itchy nose, there is itchy feel in your palate, in your mouth. There is itchy feeling around your eyes and a lot of watering from the eyes, as mentioned in the slide. Also, a lot of patients come with a leaky nose, a runny nose, and recurrent sneezing episodes. Sneezing episodes are such that they have bouts of episodes. The minute they wake up in the morning, they'll have a continuous bout of at least 10 to 15 sneezes at a time. And uh, nowadays, we are seeing also patients having a little difficulty in smell, which wasn't the case before. But parosmia or anosmia is what we call the medical term, is where we're finding patients with allergic rhinitis also unable to sense smell, uh, which they used to before. Symptoms that may develop later on include a stuffy nose like a nasal congestion, coughing, soreness of throat, puffiness under the eyes, fatigue and irritability, and headaches. So, allergic rhinitis in the later stage, what classically happens is where I will like to link a nasal bone deviation as well in this particular slide, is that a patient will be having a lot of sneezing episodes and a runny nose. And very clearly, every person in the family knows that this uh, a family member or relative is an allergic patient. But what they won't understand is allergic rhinitis can also come hand in glove with a nasal bone deviation. And that is where the later symptoms start developing. So nasal bone basically what we call is the center of the nose, which is the nasal septum. And that bone can be deviated for XYZ reason, which I'll be talking about in the further slides. And because of that nasal bone deviation, your allergic rhinitis can get aggravated, causing a nasal congestion leading to headaches, and also the nasal secretions which cannot drain out classically go down into the throat, causing coughing, or what we call again in medical terminology as post nasal drip. It's basically just beneath the nose and going into the throat. And other thing I want to mention about a patient sign which we might have seen in our family members is they keep on rubbing their nose like this. They keep
Right.
on doing this, they keep on doing this. They have this tendency of keeping on wanting to rub the nose and trying to just clean it. This is what we call as allergic shiners. And what classically happens also in such patients is that they have puffiness around the eyes, which is at a later stage, and you might also see a bluish tinge right under the eyes, which is a pickup sign for a clinician that this patient is having a severe form of allergic rhinitis.
So, doctor, when you talk about that nowadays allergic rhinitis is coming with, there's no sense of smell, no sense of taste. Do you think COVID is a major reason for this addition? Because initially it was not there, but post COVID we are having this particular symptom.
Yes, so what also we have noticed is that the virus is persisting to a large extent within the system, maybe in the dormant form, and we are finding allergic rhinitis patients coming with anosmia where COVID could have an indirect relation, but the establishment of that relationship can be a topic of discussion in terms of a a patient database where we can collect data of such patients and then see if there is a direct correlation which does exist post COVID in such patients. So that's a topic which we can ponder over, and I think we should, because finally our entire goal is to give the patient a symptom-free lifestyle and prevent the recurrence of such symptoms in future. Can we have a little magnification of the slide, please? The previous slide, Miss Patil. Yeah. Can you magnify the slide a little bit?
I'll
Uh,
just see if I can magnify.
okay. Yeah, I think this
Actually,
will do. This will do. So
this
coming to
will
allergic
do.
rhinitis, yeah, thank you so much. So there are intermittent symptoms of allergic rhinitis and persistent symptoms in allergic rhinitis patients. Persistent, as the term you're aware, it's continuously throughout the year, and intermittent is those symptoms which are in milder form and less than 6 weeks, or roughly you can say 1.5 months. So the milder forms of allergic rhinitis and its symptoms. So we can have a mild intermittent allergic rhinitis or a mild persistent allergic rhinitis and a moderate to severe form of intermittent allergic rhinitis and a moderate to severe form of persistent rhinitis. It's very clearly mentioned in the slide. So the mild symptoms are the patient's sleep isn't disturbed, the patient is having normal sleep, there is no impairment of his routine daily activities, be it a sport or a leisure activity. There's normal work at place and there's no disturbance at school as well. And these basically are non-bothersome symptoms. In the mild form, sleep is unaffected, your daily routine is unaffected, and so is for children when they're at school, they're not having an issue per se. But the moderate to severe form is where we need to actually pick up the illness early and start the treatment, where the patient is having disturbed sleep, the patient is having impaired daily activities, be it a sport or a leisure activity, and more so a lot of children who are unable to concentrate in school for a longer duration of time. So we need to really identify these children because what happens, a lot of parents are unaware of allergic rhinitis causing uh, lapse of concentration. They will feel that the child from the beginning itself was having a lapse in concentration, or maybe there are children who seek attention because of which their concentration also lapses. So it's a very fine line to identify this category of children and to treat them at the earliest, because finally what happens is when allergic symptoms does aggravate in a child's nasal cavity, he starts getting nasal congestion, a nasal block, because of which a child cannot breathe through his nose. God has been very kind to all of us that He's given an alternative route to us in the form of our oral cavity where we can breathe through our mouth. But the problem, what happens with mouth breathing, is that it causes an exertion on our respiratory muscles, and mouth breathing can lead to lapse in concentration. So when a parent sees that a child is having nasal issues, like he keeps on uh, fidgeting with his nose, he's having sneezing bouts, not to an extent of having it daily, but maybe once in a week or once in 2 weeks, or maybe during the seasonal variation, the allergic episodes are increasing and they see a drop in his grade. Drop in his grade could be a pickup criteria or an indicator for the parent to know that maybe the child is not able to concentrate at school because of his issue, leading to his drop in grades. So this is something which is very important for a parent to understand in his child, and also for someone who is an adult to understand at his workspace whether he is not able to give enough time to his target or goal which he's supposed to achieve in his firm, uh, as he's mouth breathing more than nasal breathing, causing a lapse in concentration, and which can lead to fatigue and tiredness. So, what I want my viewers to understand is we need to pick up such patients. Your body is a very good uh, machine, it gives you the signals at the right time. It is for you to pick up that signal and show the clinician at the earliest. Can we have the next slide, Ms. Patil? Thank you so much. Yeah, so now coming to the treatment and the prevention aspect of allergic rhinitis. So, as it's very clearly mentioned, we always have a stepwise treatment in allergic rhinitis patients. We cannot go to immunotherapy at the earliest, or maybe starting the patient on intranasal corticosteroids the day he enters the OPD. We need to first understand his problem, see the severity of his allergic rhinitis, which was talked about in the previous slides, whether it's an intermittent form or whether it's a persistent form, and in case it's an intermittent or a persistent form, whether it's mild or moderate to severe. And these are criteria which have to be discussed with the patient. The history is very important in such patients because from the history we can get a provisional diagnosis in mind before we clinically see the patient. So it's very important to understand the patient's symptoms from a history point of view and then go ahead with the clinical diagnosis. So allergen avoidance is very, very important, and I feel that's the first step which we all need to work on, because if allergen avoidance can be achieved, especially indoors at home, then all the other treatment or modalities of treatment mentioned in the slide any role to play. So first coming to the allergen avoidance, which I want to talk about. So we all, I think most of us, for some reason, if not all of us, are working in air-conditioned spaces at some point in our life. So what classically happens is these air conditions which are there in the workspace, they aren't serviced very frequently. So the humidified air which is actually being let out through these AC inlets, that's the one which is triggering the allergic rhinitis problem. So you may not be a patient of allergic rhinitis in terms of symptoms, but in case you're exposed to the air condition throughout the day, maybe 6 to 8 hours in a day, that's where your symptoms start building up, and then you're diagnosed as an allergic rhinitis patient. So what I want you all to understand is that the ACs which we breathe in is humidified air. They aren't serviced very frequently, be it the cabinet AC, the split AC, or maybe a centralized AC. So what happens is what air you are breathing out, you are re-inhaling that air, and the same system flows. So there is no purity of air entering your nasal cycle, hampering your nasal circulation and causing symptoms. So, firstly, what I advise my patients is that every 2 hourly they need to step out of the air conditioned space for a couple of minutes, 2 to 5 minutes, either in the lobby area or near the elevator, take in the few breaths of fresh air and come back inside. So, point number one, that's very important. Second thing which they have to keep in mind is all the bed sheets in their room, all the doormats, all the floor mats, all the mattresses, and the pillow covers, a major source of dust mite and allergens. They need to be washed in hot water. Mind you, I'm stressing on the word hot. It's not warm water, it's not lukewarm, it is hot water. They have to get these washed once in 1 week or twice in 1 week, or maybe once in 2 weeks, is as per the convenience of the person, but they have to do this religiously. Why I'm saying hot water is because the dust mite which settles on these pillow covers and bed sheets, the minute you wake up in the morning, they attack your nasal mucosa. It's open, right? And that is when you start getting these bouts of sneezing. So it's very important that you have to get them washed in hot water because dust mites get killed at high temperatures. Thirdly, what I want to discuss in terms of allergen avoidance is when there's dusting, brooming going on in your workspace or in your house, in your room, you need to stay away from that area or wear a mask and sit. It's very important because, again, classically, maximum people are allergic to dust, and dust is something which we cannot avoid in the atmosphere. So see to it, when you know that a particular allergen triggers your symptoms, you need to stay away from it. Fourthly, like how I tell most of my patients is make it a point to walk in an open air space at least for 10 to 20 minutes, maybe a park, a garden, or a terrace, because that is where your nasal cycle gets purity of air and this allergic issue can come down. So at least 2 times in a week for 15 to 20 minutes, if you can give time to a normal walk, I'm not even saying a brisk walk, it's going to help in your condition to get better. And finally, pranayam, yoga, and meditation. These three things are one of these three things, any form of this, is going to help with your nasal circulation and the nasal cycle to function better. Be it a nasal bone deviation, be it an allergic patient, be it anything to do with the nose or the chest per se, yoga, pranayama, meditation, and if you can't take out time for any of these for some reason, just simple deep breathing exercises is going to help your lung capacity to expand, because of which your symptoms will subside. Right. So this is something which I really wanted to discuss and highlight and put it out to my audience, because prevention is definitely better than cure. And I'm not saying that your allergic rhinitis, uproot it from its root cause maybe in the next 2 years or 3 years in case you're an allergic rhinitis patient. But definitely the recurrence of your symptoms will come down and die down gradually. So it's a must that these precautionary measures are kept in mind. Now, the line of management in terms of where we play a big role as clinicians is what we'll talk about, which is highlighted in the slide again. That's oral antihistamines. So oral antihistamines are basically anti-allergy medicines. Commonly, what we all know in the market is a cetirizine tablet. Right. So the only problem with the cetirizine tablet is that it is a older generation of an anti-allergic where your symptoms no doubt can subside, but the problem is it is a sedative drug. It causes a lot of sedation. We always tell patients that when we have the option of a newer generation of antihistamines or anti-allergic medications, which don't cause drowsiness to a large extent, then why should you go for a cetirizine? That's the only debate a patient has with us, that they feel relief with cetirizine. No doubt they feel relief, but they should understand that in case they have to wake up in the morning for XYZ reason, for a meeting or for any other reasons, particularly children who need to wake up early to go to school, morning schools, for them, this medicine causes a lot of drowsiness, which can also impact their studies, because in case some parents take it without a doctor's prescription and give the child the drug twice a day, he would be drowsy throughout the day at school also. So it's very important for me to inform you all that a newer generation of anti-allergy is important, lesser side effects in terms of drowsiness, and the duration of action is within an hour. So the newer generation of drugs is what we are aware of as a levocetirizine or a fexofenadine, and the latest one which is come in the market is a, a drug by the drug constituent, which is belastin. So now, coming to allergic rhinitis treatment, why a combination of montelukast with an anti-allergic is important, whether it's montelukast with a levocetirizine or whether it's montelukast with a hexofenadine, or the newest form of medicine, as I mentioned, is belastin with a montelukast. But montelukast is a very important constituent, or I might say an ingredient in the management of allergic rhinitis patients, because it basically acts on the chest receptors, and because of which the allergic rhinitis can not trickle into your chest, causing an allergic asthma issue, and it can also prevent the recurrence of symptoms to a large extent. So, a combination of levocetirizine with montelukast or a fexofenadine with montelukast is what I usually prescribe to my patients, and I've seen wonderful results. No doubt that it has to be taken for a longer duration. I'm looking at somewhere between at least 2 months at a stretch, but I always tell my patients to make friendship with the medicine rather than avoid the medication, because you need to get your acute episodes relieved in your system, because of which your work cycle and your life cycle can become better. So a combination of this is very important. And along with this combination, what we classically give patients is nasal drops. Nasal drops, what you must have again come across in the market as a xylometazoline or an oxymetazoline form of nasal drops. So our main concern at the first visit of an allergic rhinitis patient is also to see whether he has nasal congestion or a nasal block. Because classically, anyone who understands allergic rhinitis talks about just sneezing episodes, which I agree. But as we mentioned in the slides before, that nasal congestion or a runny nose is something which is a later onset of symptom form in allergic rhinitis patients, which needs to be looked at. This is where the nasal drops play a big role, because our main aim right now at the first visit is to decongest the nasal blockage. Once we decongest the nasal blockage with these nasal drops, that's when the patient's breathing becomes better, his mouth breathing subsides, and then what we call is the second line of management in allergic rhinitis patients, and also the most important line of management, which is the intranasal corticosteroids. Intranasal corticosteroids, as the name suggests, it's basically a steroid, right? And as the term steroid comes out from my mouth, I think at least 90% of the people viewing this would just be taken aback, because we all know what steroids can do in the long run. So I want to really clear the myth or the misnomer with this intranasal corticosteroids, which is also asked to me by a lot of my patients. So I'll be talking on that. So intranasal corticosteroids are the treatment of choice, and mind you, the second line of treatment in allergic rhinitis patients. The duration of the steroids can be anywhere between 3 to 6 months, and maybe even 1 year to 2 years based on the symptom uh, response to the intranasal corticosteroid. So, what classically these intranasal corticosteroids do, their main aim is to prevent the recurrence of the symptoms. As I mentioned to you, that the nasal passage is open now, it's clear after the nasal drops. So after the nasal drops for a week, we come to the nasal steroids. So they basically are like any perfume, deodorant which you must have used some point in your life, right? So they basically are nasal sprays which you need to spray within your nasal cavity. Now, when to use these sprays and how to use these sprays and for how long is where we come in place or we come in picture. So, classically, there's a way of using the intranasal corticosteroids and a time to use the nasal spray, not that you can use it any time of the day or whenever you wish to. So, the minute you wake up in the morning, the first thing you do is the nasal spray, that is the intranasal corticosteroid. So you need to sit down, bend a little, look down, take the nasal spray in your right hand, put the nozzle in the left nasal cavity, in the left nostril, take the nozzle inside and just press, and a mist will go inside your nasal cavity in the nostril. You just have to
Dr.
do
Vidit,
it
can you
one
repeat?
puff on the left side and then alternately use your left hand, go in the right nostril and press and inhale. So it has to be done only one puff in each nostril, not that you have to do it two, three times together. Some people will do it lying down. Hello,
Yeah, Dr. Vidit, actually, we are losing you in between. There's some
am I
network issue,
audible?
right? Yeah, you're audible very much, but your video is not that clear. It's slightly blurred.
Hello,
Yeah, we can hear you.
Ms. Patil, am I audible? Is there some issue
Yeah,
technically?
your audio is very much. We can listen to you, but your video is not that clear.
Okay, so okay, so I'll just talk about the nasal spray again. So the
Yeah.
way we use the nasal spray is okay, okay. Say I'll just use it again. I'll just show the demonstration again of the nasal spray. So the minute you wake up in the morning, the first thing you do is the nasal spray. The right hand in the left nostril, you would just press and inhale, and alternately left hand, right nostril, you press and inhale. It has to be done in the sitting posture. You can't do it lying down. So that's also something which patients should understand. It is to be done alternate hands and in the sitting position. Now, why do I mention the first thing in the morning we should be using the nasal spray? The minute you wake up in the morning, the first thing you do is the nasal spray. Your routine is afterwards. Your teeth brushing, your breakfast, your daily routine has to be followed after the nasal spray and night just before you go to bed. Now there is a very scientific reason why I'm mentioning this. The dust mite which collect on your pillow covers and bed sheets, they do collect in the night and early in the morning. In the night, they're on your bed sheets, and the minute you wake up in the morning, they attack your nasal cavities. So, our intent out here is the minute before they attack our nasal cavity, we have to decrease their attack or kill them then and there so that they don't vegetate with your nasal mucosa, nasal skin. So that's where you need to use the spray just the minute you wake up in the morning and night before you go to bed. Now coming to the biggest concern which most of y'all will be having, it's a steroid. So I must tell you that it's a local application of steroid and not a systemic application, which means any dermatologist which you must have seen in some point in your life for XYZ skin disease, they give you a local application which is a steroid based formulation. Similarly, we as ENT surgeons are giving you a steroid-based nasal spray, which is only going to act in your nasal skin. It is not going to go in your bloodstream. So be rest assured that whether you are a diabetic, and I know why I'm using the word diabetic here is because steroids do cause sugar levels to shoot up in the body. But be rest assured with all my patients which I have used in nasal steroids, especially those who have diabetes, it does not have any impact on their sugars. It is not going to go into the system. We're not giving any oral form of steroids or any injectable form of steroids where it's going to increase his blood sugars, causing his sugars to increase, and maybe he could get episodes of hyperglycemia. So this is one myth or a misnomer I really wanted to uh, highlight upon and address my audience about. Now, coming to the next point of treatment, which is leukotriene receptor antagonist, which I spoke about, that is montelukast, which I spoke about, that it's going to act on your chest receptors, causing the allergic issue not to trickle into your chest, and that's going to help you in the long run. Allergen immunotherapy, something which is a recent advancement in allergic rhinitis. Not that every patient who does have allergic rhinitis requires this form of treatment. And as per my experience, again, I can say that 30% of my patients do respond to this, but 70% don't respond to this. That is why I focused and emphasized most on the first part, which is the allergen avoidance, because for me, that is where the entire treatment aspect lies. So this was the entire treatment and prevention aspect of allergic rhinitis. Can we have the next slide, please, Miss Patil? Yeah. So now coming to something which I introduced in the start of the discussion, that allergic rhinitis patients with a nasal bone deviation. So just a slide on nasal bone deviation. A deviated septum occurs when the thin wall, that is the nasal septum, that is the middle of the nose between your nasal passages. So between your two nostrils, you have a bone right in the middle, which is the nasal septum, that is displaced to one side. In many people, the nasal septum is off the center or deviated, making one nasal passage smaller. Or you can say that you sometimes always talk about patients who have gross nasal bone deviations, that they feel they're only breathing through one nostril and the other is always blocked. So this is what they mean by one nasal passage becoming smaller, because the nasal bone is deviated to that side. The causes could be it is present at birth, no doubt. Any injury to the nose, maybe a sports injury, or you accidentally fell down, or you met with an accident on a two-wheeler or a four-wheeler. God forbid it happens to any of you all, but it can. So these are the commonest two conditions we have seen where a patient can have a nasal bone deviation, or what we call in our terms as a deviated nasal septum. The aging process may affect nasal structures, no doubt, but with age, a lot of other issues also occur in the body and not only the nose aspect. But I really want to emphasize here is that every patient who has a nasal bone deviation need not have symptoms. I'm making it very clear that it's not that everyone who has a nasal bone deviation should have symptoms. We as clinicians can see a nasal bone deviation when we see a patient, but if the patient doesn't have symptoms, we don't do anything. So important for you all to understand that you are not a patient of a deviated nasal bone in case you don't have symptoms. Can we go to the next slide, please? Yeah, the symptoms of nasal bone deviation, or what I call as the red flags, are important. One is nasal blockage, nasal obstruction of either one or both the nostrils. Nasal bleeds can occur timely. A lot of facial pain, uh, mouth breathing more, especially during sleep. Awareness of the nasal cycle, preference for sleeping on a particular side. So those are again very ambiguous points, but yeah, they do occur in some patients. But I really want to highlight the fact about facial pain and nosebleeds now. So why does a nasal bleed occur when it's a nasal bone deviation? So again, physiologically and very scientifically, I want to convey to my audience is that your nasal passage is always along the floor of the nose. Your nose breathing is through the floor where it goes posterior or behind, and that's where your breathing uh, is normal, or you are able to breathe properly through your nose. Now, whenever this floor of the nasal cavity has a bony structure which is obstructing that floor, that is where you can get a nasal bleed. Why so? So the scientific or the medical term is it's a nasal spur. A nasal spur is different from a nasal bone deviation. The nasal spur does impinge on the nasal skin, because of which you can get nasal bleeds. So that's why don't feel that every nasal bleed is not to do with nasal issue. It can also it can be to do with other factors as well. But one factor in the nose which can cause a nasal bleed is the nasal spur, the nasal bony spur. And now coming to facial pain, so any deviated nasal septum can cause sinusitis, which in turn can cause facial pain and headaches. So sinuses are air-filled cavities which are right adjacent to the nose. So you can have facial pain and facial congestion, because what classically is happening is that the airflow cannot go to and fro the sinus because of the nasal bone deviation. So the nasal secretions start collecting inside the sinus cavity. So instead of air in the sinus, you are having cough in the sinus, because the nasal secretions which can't drain out because of the nasal bone deviation start collecting in the sinus, causing headaches and facial pain. Now, treatments for a nasal bone deviation are similar to an allergic rhinitis patient, but it is more to do with nasal decongestants. As I mentioned, that you can have an allergic rhinitis patient with a nasal bone deviation, because of which his nasal congestion takes place, his nose gets blocked. So we put the xylometazoline or oxymetazoline nasal drops to open the block, and then we use the nasal spray to maintain the patency of the nose. Some patients whether the nasal bone deviation can get corrected with nasal sprays or these nasal decongestants. So let me be very clear that a nasal bone deviation is a bony structure, as the name suggests, it's a bone. So a bone can never be corrected with a nasal spray. It can only be corrected with a surgical intervention. That is where a septoplasty comes in play. But for me to tell you right now is that we don't ask patients to undergo surgery at the first visit. We give the patients a trial of nasal decongestants, nasal steroid sprays, and antihistamines, anti-allergic medications. And even after the treatment, the patient has recurrence of symptoms or his symptoms don't subside. That's when we go for a CT scan to see whether the nasal bone deviation is causing a sinus issue as well, or whether the nasal bone behind or posterior aspect of the nose, which we cannot see, because if you're having an anterior deviation which is going posteriorly as well, you cannot see that, which can only be seen on the CT scan or by doing a nasal endoscopy. That's when we can uh, correct the problem in case the patient doesn't subside with medication. So a correction is the last resort. It's a resort which is always there. The door is always open, but why not give the patient uh, relief symptomatically with the treatment and obviously the uh, preventive measures, and then jump to the surgical intervention in case his symptoms persist. And the last point I want to highlight before I close is that nasal decongestants, your nasal drops, be it your xylometazoline or oxymetazoline nasal drops. So people may not be aware, but they have addictive potential. So I understand that when you put those drops, your nasal blockage opens immediately or in the next 5 to 10 minutes, and that's when you feel that every time your nose gets blocked, you keep using those drops time and again very frequently. And mind you that those cause addictive potential, and they also cause something known as a nasal bone obstruction. It's a paradoxical nasal bone deviation. You don't have a nasal bone deviation, but the nasal drops can cause your site to get obstructed. So you might feel that it's a wonder drug in terms of the drops being instilled, but it should not be used for more than 5 to 10 days at a stretch. And in case you want to use it by yourself in future, you must consult your clinician, the ENT specialist, whether he or she allows you to use the drops in future. Yeah, so this was the uh, discussion I wanted to talk about in terms of the nasal bone deviations and allergic rhinitis. And I really hope that I have sort of ingrained in you and given you information which maybe you weren't aware of, or minor lifestyle modifications which we all can do from our end. But maybe we're not finding the time, or we're not understanding the graveness of the situation when it comes to preventing ourselves from getting the illness rather than treating it with allopathic medications when it worsens.
Yeah.
Uh,
So, yeah,
mm,
doctor, just to before concluding, we particularly don't have any questions right now from the audiences.
All
But
right.
whatever lifestyle modifications you mentioned during the allergen avoidance and uh, during the nasal bone deviation, also whatever things you've mentioned, we definitely have taken a note of it, and we'll make sure that if an allergic rhinitis patient is around, we make sure that all these precautions are taken care of. So we'll definitely do it, and we'll definitely follow your instructions, whatever you instructed. So yeah, so Dr. Vidit, thank you so much for your valuable time and for your valuable insights which you shared on allergic rhinitis and nasal bone deviation. It particularly has resonated well with all our audiences which were present here in this live session. Okay, and also we really deeply appreciate you're communicating those complex terms, and making us understand the treatment zone, or maybe what exactly is nasal bone deviations, and what are the treatment regimes for these particular two diseases or conditions which a patient might have. So thank you, doctor, so much for explaining us that as well. We deeply appreciate the time you have invested in us and giving us your valuable time for this webinar. So C2C is very much obliged and very much what do you say, we this presence of yours is really invaluable to us. So we deeply thank you for your time, and we are eagerly waiting for any anticipation for future collaborations with you, Dr. Vidit. So thank you so
Thank you
much for
so
your
much,
time.
the team of C2C, Miss Patil, and all behind the scene as well, Mr. Dhava and Mr. Nischal. Thank you so much for giving this opportunity to me to sort of reach my audience out, and also in the best possible way to make them understand what their situation is and how we can go about in a stepwise manner. Thank you to the audience for being so patient and understanding what I was trying to explain, and also giving the feedback. So thank you so much. I am really, uh, I really can't thank you all enough, but thank you for giving me this platform to uh, make my points clear out in the open. And thank you so much, Miss Patil.
Thank you so much, doctor. Thank you so much. Have a good day.
Thank, thank you.
Bye.
Same to you. Bye. Take care.
Take care.